Should you take a frontal shot on a whitetail? Let's find out. So there's always been a lot of controversy, right, about taking a frontal shot on a white-tailed deer. I mean, it's a small space, there's a lot that can go wrong there, and it just is something that as a hunter you need to consider if it's ethical. Are you proficient at that? Are you that good of a shot? And do you really know your anatomy? So today we're going to talk about shot placement. Is it ethical? But first we're going to tie that into looking at the actual anatomy of the frontal shot. I really think it's important to know the anatomy when it comes to a whitetail for any shot, but especially if you're going to consider a frontal shot. This shot right here, you really need to know what you're getting into and how small your margin of error really is. I mean, you really don't have a lot of room. Now, out of the gate, I will say, this is a young deer. So as a deer matures and gets bigger, these ribs get wider and thicker. The spaces between the ribs will narrow just slightly. And this rib cage, of course, will come out. It'll give you a little bit more room when you're looking at it straight from the front. But I think as we look at it here, this is a really good visual to understand that there's not a whole lot of room here. So this would be the whitetail directly looking at you. And as you look, the sternum starts here. You have the neck here, which of course would be curved up. And then you have this small open window. Now, if you are proficient and the deer's looking at you and you're confident in that little hole, then that is up to you. If you get the arrow in here, you certainly are going to be into vitals right away. Now the brisket is thick here, keep in mind. You got some gristle in this area, you got some thick, heavy muscle meat, you got fur to deal with. Often on a whitetail, there's a big piece of heavier fur directly in the front. So take that into consideration on your setup too, if this is a shot that you're going to consider. For me personally, I would rarely ever take a frontal shot. It's just not what I like. It's just too small of a margin of error for me. I am proficient, but I don't feel that, for me personally, that it's an ethical shot to risk. So I'm a broadside guy, slightly quartering away guy. I don't want to take that risk. But you have to make your own decisions based on your skill level and setup, what you want to do. But as you look at this, you can realize this is a small target. And also, to interfere with this is the scapula and the front legs. So a scapula will typically rotate right about the second or third rib area. So your scapula is right here. Now, most of the time your scapula is going to sit like this. The scapular ridge is facing forward. So another neat little tidbit is, if you wonder a lot of times, well, how do archers usually get through a shoulder blade? It's because the thinnest part of the scapula is facing the vitals. So if your target area is that vital V or right behind the shoulder, if you do get a little far forward, usually you're getting into this thin area of the scapula. And like this K2 fixed here, you can punch right through it. But as you get more forward, now you're dealing with the thicker part of the scapula. You have this big scapular ridge here. You have the heavier front bone of the scapula. And as this comes forward, you're also going to have to deal with this lower leg bone, and it will come right here and pivot back towards the deer, just slightly right here, but it completely covers this front area right here. So you have to deal with that. So if you're looking at directly in front, basically, you're dealing with this front open hole. That's all you got. If you're dealing with slightly quartering, that margin of error gets tinier and tinier because you're losing that window, and now you're into scapula. So if you talk about people that like that frontal quartering position, I hate this too, because you're looking at this being your sweet spot here, right behind the scapula. Can you get through here? Yes, you can. Are you going to get a complete pass through? You have another scapula on the other side right here, so maybe you won't. Maybe your angle is steep enough that you will get that all the way into the vitals, but it is risky. So you really have to think about the risk factor involved with these frontal shots. Now, I know that there's some crossbow archers, and some of them are on the ground or in blinds, and they get a front shot that's close, and it's just kind of like, a normal shot for them. And that is fine if that is your consideration. But you really need to think about, especially if you're a new archer or somebody that's trying to, let's face it, when you're in the thick of it and you have that deer and maybe it's a big buck and your immediate first shot is he's facing you and the adrenaline's pumping and you're looking and maybe you're already drawn back and you're starting to get fatigued. You have to let it play in your mind. Am I doing the right thing? Am I proficient? Do I have the right broadhead? Do I have the right arrow? Do I have enough momentum to do what I think that I can do? Is my setup perfect? Am I perfect? And if you feel that you are, that's up to you. But you should consider that this shot may be very difficult to take in any situation.